Welcome to our webinar. I'm Julia, Dr. Shiner's nurse practitioner. Just give everybody a few minutes to join on here. Hope everybody is staying safe at home. And let's see if I can give everybody a couple minutes. Hi, everyone. Thank you for joining. Let's see. Okay, share screen. Can you guys hear me better? Okay, let's see. Share screen here. Share. How does that look? Hi, everyone. Thank you for joining. Today, we are going to talk about Halo, which is our newest laser that we have here in our office. And I'll try to answer everyone's questions as they come up or at the end of the presentation. And then we will also have a special Halo offer today as well. We'll be seeing that shortly. And then we'll get started. All right, let's see. View, presenter, view. How does that look? Good? Okay, so today we're going to talk about Halo. And we just want to say thank you to our first responders and our doctors and our nurses, and thank you, our patients, for staying home, and also thank our essential workers for helping us in these hard times right now. So. Let's see, let me get this. Play. Play. Okay. There you go. All right, so today's Halo special offer is going to be if you book a full face Halo in the month of May or June, you can receive an additional neck treatment incentive. So stay tuned for the code afterwards for that. Okay, so Halo. Halo is the world's first hybrid fractional laser, and it delivers both an ablative and non-ablative wavelength. So what does that mean? So there are two wavelengths creating little tiny holes in the skin at the same exact time. One is deep and the other is superficial. Because those holes are so small and microscopic, this device allows us to treat a fraction or a percentage of the skin, which is why the skin heals extremely fast with very little downtime compared to traditional laser resurfacing. What results can I expect? So you can expect to see an improvement in skin crepiness and overall a softer, smoother skin complexion. After your skin is healed within 5 days, you can expect to continue to see a gradual improvement over the next 3 to 6 months because it takes some time for that collagen to build up. And I love this procedure because it's an aesthetic investment in your skin that's going to benefit you for the long term. And the results should peak about 9 weeks, and then your skin will continue to improve, like I said, over the next 3 months to give some time for that collagen to build. How many treatments will you need? So what I love about Halo is that it's completely customizable. Each patient is different and has different concerns, and I like to include you in the decision-making process. So during your consultation, I can listen and I can assess your skin, your needs, and whether it's texture, sunspots, enlarged pores, or maybe it's all the above, and then we can kind of adjust the settings as we go. So I usually recommend at least 1 to 2 treatments per year, depending on your age and the amount of sun damage that you may have. And we also have the option to do one or two deeper treatments, or you can do multiple lighter treatments. So it just depends sometimes on the patient preference. You know, for me, myself, I don't, I take really good care of my skin. You know, I do a home regimen. I'm constantly exfoliating and microneedling and doing all these things to my skin. So I prefer to do a couple of lighter treatments than just one heavy treatment. So it's sometimes can be up to the patient, and we can kind of decide what your preference is. Let's see here. All right. So let's go to the next slide. Okay, what happens during the treatment? So before the procedure, I use this machine that we have in our office. It takes a skin analysis image of your face, and then I use effective numbing cream on all my patients for about 45 minutes, so there's no pain during the actual procedure. We treat the face in sections, so after each section is treated, your face will start to feel warm, like a sunburn sensation, and then that may last about 2 hours after the treatment. So you can use cool compresses and ice packs to help this. And then the aftercare is really, really simple. Just a medical grade, gentle skin cleanser, moisturizer, and SPF. And here's a treatment video of one of my patients. Let's see if you can hear this. You can see there's a little roller that gently rolls on the skin, and then that red light is the laser kind of creating the hole in the skin, which you can't see with the human eye because, like I said, it's a very tiny microscopic hole. So let's see, play. That's kind of, you can kind of see that. Okay. So can you return to normal activities after the treatment? Yes, absolutely. The only thing that I would avoid is for the next 5 days is sun exposure. You don't want to be, going to the beach or any kind of amusement parks, and you don't really want to be sweating excessively. So no hot yoga, no steam rooms, no saunas, but you can go about your normal activities, just making sure you're wearing the sunblock during the day and just keep your skin moisturized. And you can also put on makeup after the first 24 hours. If you are going to put on makeup, you might need to do a double or triple cleanse to kind of cleanse the skin at night to get the makeup off. Okay, when will you see results? So you will see the initial results between 2 and 5 days after your Halo treatment, but your skin, like I said before, will continue to improve over time. That collagen is going to take time to build up for the next 3 to 6 months. So your skin is just going to keep looking better and better and better as the weeks goes on. Let's see. Okay. How long will your results last? Your results will last for years to come as long as you continue to keep your new skin healthy and protected at all times. And as far as maintenance goes, so after the Halo, say you have a Halo once or twice a year, I would still continue to do your BBLs or IPL light treatments 2 to 3 times a year for maintenance, because you want to, keep that good skin looking good. So you could do a BBL or IPL procedure as soon as 4 weeks after the Halo. And I like to do that because it helps kind of clean up the skin after the Halo from all the trauma, clean up any kind of broken capillaries, and the light energy will just kind of help enhance the smoothness of the skin and that glow. I also recommend after the Halo, like 1 to 2 weeks, getting a hydrofacial with Allie, our esthetician. And that will really help get off all the debris and dead skin that the Halo kind of exfoliated out. So that also helps. And the hydrofacial will also give you a nice hydration too. Okay, so now we're going to talk about UV damage and age progression. So this picture, it's a visual that you can see as we increase in our age, so does the years of sun exposure and the kind of effects it has on the underlying skin. So you can see from 15 years old to 43 years old, the amount of sun damage and the amount of sun exposure over time that we are exposed to. And Halo can really help reduce this. Okay, so this is somebody who is 56 years old, and you can see the pre-picture of the sun damage and the post picture. She had 2 halo treatments. You can look how much sun damage that it kind of cleared up. And I'd say if you're over 50 years of age, you really are going to need at least 2 treatments. And here you can see now the pictures compared after this 56-year-old woman had 2 halo treatments, her skin is more comparable to the sun damage of a 15-year-old. So it really does, the benefits, it just makes your skin so much healthier. It not only looks good, but it's actually making it healthier. Here's another example. This is a 65-year-old woman who had 2 halo treatments. You can see the underlying sun damage. And sometimes this underlying sun damage isn't always on the surface, but it can always come up to the surface as we age. So these is from years and years and years of sun exposure that hasn't come up to the surface necessarily, but it's deep and underlying. Okay, and this is an interesting picture because you can see after this 65-year-old woman had 2 halo treatments, her skin is actually starting to look better than someone who is 26 years old. So it's kind of funny because I get a lot of moms in here that start bringing their daughters in because the mom skin start looking better than the daughter skin. So it's pretty amazing, actually, the results on these. And here it is again. The 65-year-old skin looks better than the 34-year-old's skin after 2 halo treatments. That's another pre-halo. Post, you can see the sun damage just kind of cleans it all up. And then we're going to go into some more before and afters. Let's see here. So this is someone who has melasma. So for complex conditions such as melasma or scarring, you're really going to need 3 treatments to get a good result. This is a pretty decent result after 1 treatment, but I recommend for melasma at least 2 to 3 treatments. But we can just do 1 and kind of see how it goes. And start with 1. And then we can also treat uneven texture. A lot of people around the perioral region, they start to get these fine lines and wrinkles. So this is uneven texture around the mouth area. And then pores, you can see the reduction in the pores before and after. It's almost more than half of a reduction in the pore count. That's pretty good. Again, here's pre and post halo. I think she has a little bit of melasma just after 1 treatment. So like again, we're treating a percentage of the face each time. So each time you're treating up to anywhere from 10 to 30% of the face. So that's why it takes a couple of treatments to kind of get full coverage with that. And the reason why we only treat 20 to 30% of the face at a time is so we only have that quick little downtime of just 5 days. Someone's perioral lines again. And then someone's texture, uneven texture and tone on the cheek. And we can also treat darker skin types. Halo is actually the preferred treatment of choice for darker skin types because I'm able to control the heat in Halo, whereas with IPL and other heat devices, I can't control the heat. So there's actually less risk of adverse reactions like hyperpigmentation or rebound melasma with darker skin types with Halo. And this one was actually a combination BBL Halo. You can see the spots on her cheek were treated with BBL, and then the overall face was treated with Halo. 2 BBLs and 1 Halo. We can also treat Halo anywhere on the body, which is amazing because we can't do that with traditional laser resurfacing because it's just too aggressive. But with Halo, we can treat anywhere on the body. So this is 1 treatment of somebody's knees, and it's not for tightening, but it's going to be for texture and skin crepiness. And this is actually a photo of mine, a patient's abdomen. She just had concerns with just some texture issues. And just after one treatment we did end up doing a second treatment. I don't have the photo from the second treatment, but she really, really, really enjoyed this treatment. So we did go ahead and do another one. And then this is someone's hand. So this is the treated hand on the left. You can see how the little white holes are the little holes that the laser penetrated through the skin, and then on the right is the untreated. So this is kind of what you look like immediately after the treatment versus non-treated hand. And then we can also do combination treatments, Halo and BBL. We would do BBL first, then Halo on the same day. Like I said, anywhere on the body. This is somebody's scar on their tummy. She had 3 BBLs and a Halo. You can see the improvement there, and the discoloration. The redness is lighter. It's lighter pink. This texture is smoother. I think they may have also done her belly button too. And this is our men love this combo BBL Halo because it kind of simplifies their routine. So men tolerate the BBL Halo combination procedure really well, and they tend to heal a lot faster because of their facial hair. So it simplifies it, because if I could just get them in the office, do one time BBL Halo, and then only have to see them 2 or 3 times a year, they really tend to really enjoy this combo. So I try to do that on my meals as many as I can. Let's see again, BBL Halo combo. And this is another BBL Halo treatment. You can see 2 BBLs and 1 Halo. So it really kind of has a synergistic effect when you do them together. Okay, so let's talk about healing. So we could do, like I said, a light treatment. This would be 5% a light treatment, 5 to 10 to 15% would be a light treatment. You can kind of see the progression of the healing before day 1, day 2, day 3. Day 2, 3, you kind of have this like gritty sandpaper texture until the dead skin kind of sloughs off. This is a 20%, 25% moderate treatment. So you can see day 1, day 2, day 3, day 4. You're always healed by day 5, as long as you stay within that 20 to 30% treatment range. And this is the 30%. This would be a moderate or to heavy treatment. You could see you're definitely day 2 and 3, definitely more red and sunburned. So if you wanted to do a more aggressive treatment than 30%, then I would probably recommend to do a virtual consult with Dr. Shiner for deep laser resurfacing options, or the reset procedure that he was talking about yesterday on his webinar. Okay, and just the benefits again of Halo, why it's good for your skin, what it's approved for: wrinkles, scarring, skin resurfacing, skin texture, sun damage. It reduces the appearance of pores, discoloration, uneven tone. So it kind of has a global improvement of everything, which is why I love it so much. Okay. And are you guys ready to get that Halo glow on? So here's the incentive today. If you book a Halo full face, May or June of this year, then you get an additional neck treatment incentive. So you can use the code, you can screenshot this, take a picture of it, use the code Halo 2020 to receive your credit, or you can click this link to book a virtual consult, or you can also email new@adamshinermd.com to get this offer. And once again, thank you to our first responders, doctors, nurses, and essential workers for helping us through this time. And let's see if we have any questions. There's our email, Facebook, and Instagram. Please follow us. Let's see. The offer screen. Let's see. Is it sharing? Is it sharing now? I think I have to Let's see, share screen. Any questions on Facebook? Share.
And play so you can see it.
Play.
Just wait a little longer. Maybe talking back.
Yeah. All right. Well, thank you guys for joining me today. And you can also email if you have any questions. All right. Thank you.